Module 4, Social Determinants of Health, Access to Healthcare. After completing this module, participants will be able to define social determinants of health, describe components of social determinants of health, understand access to healthcare, and describe barriers to access healthcare. Social determinants of health are non-medical factors that influence health outcomes. Mahmoud describes 10 social determinants of health, which are social gradient, stress, early childhood, social exclusion, work, unemployment, social support, addiction, food, and transport. Let us discuss about the social gradient. Socioeconomic position is often described through indicators such as educational attainment, income, or level of occupation. In 2019, 65% of people aged 25 to 60 years in Australia held a non-school qualification at certificate 3 level or above. And 1 in 10 people in Australia lived in low-income households in 2017 to 18. Social and psychological circumstances can cause long-term stress. Continuing anxiety, insecurity, and social isolation can hamper health. More than 1 in 10 adult people in Australia reported high or very high levels of psychological distress. High or very high levels of psychological distress were more often reported by women than men. The foundation of adult health are laid during early childhood. Physical, social, or emotional, language, or cognitive development in early childhood strongly influence learning, school success, economic participation, and health. Children from disadvantaged communities are more likely to do poorly at school, affecting adult opportunities for employment, income, health literacy, and care. Strong social networks may benefit physical and mental health through practical and emotional help and support. Social exclusion through discrimination or stigmatization can cause psychological damage and harm health through long-term stress and anxiety. Social exclusion may result from unemployment, discrimination, stigmatization, and other factors. About 1 in 4 Australian households are lone person households. The psychosocial stress caused by unemployment has a strong impact on physical and mental health and well-being. For some, unemployment is caused by illness, but for many, unemployment causes health problems through its psychological consequences and the financial problems it brings. In January 2020, around 25% of the Australian population aged 15 to 64 years were unemployed. In June 2017, there were 1.4 million jobless families in Australia. Social support helps give people the emotional and practical resources they need. Belonging to a social network makes people feel cared for, loved, esteemed, and valued. This has a powerful protective effect on health. People who get less emotional social support from others are more likely to experience less well-being, more depression, and higher levels of disability from chronic diseases. An estimated 1 in 10 Australians aged 15 and over reported lacking social support in 2016. Individuals turn to alcohol, drugs, and tobacco and suffer from their use, but use is influenced by the wider social setting. Details of addiction is presented in Module 3. A good diet and adequate food supply are central for promoting health and well-being. The shortage of food and lack of variety cause malnutrition and deficiency diseases. Excess intake contributes to cardiovascular diseases, diabetes, cancer, degenerative eye diseases, obesity, and dental caries. The important public health issue is the availability and cost of healthy, nutritious food. Access to good, affordable food makes more difference to what people eat than health education. Healthy transport means reducing driving and encouraging more walking and cycling, backed up by better public transport. Cycling, walking, and the use of public transport promote health in 4 ways. They provide exercise, reduce fatal accidents, increase social contact, and reduce air pollution. Living in unaffordable, unsuitable, or insecure housing increases health worsens. The residential environment has an impact on health equity through its influence on local resources, behavior, and safety. Young people, Aboriginal and Torres Strait Islander, people with long-term conditions, people living in low-income housing, or people who are unemployed or underemployment are at greater risk of living in poor quality housing in Australia. Nearly half of low-income households were in rental stress in 2017-18 in Australia, spending more than 30% of their gross income on housing costs. Australia adopted several approaches to address social determinants of health. Medicare allows for access to medical care when required for all Australians. The Australians can see a GP for free or of little cost. They can get the medicine with reduced cost. However, healthy and active lifestyles need to be further promoted. Access to healthcare is determined by several factors, both at the service providers and patient levels. So service provider level factors are approachability, acceptability, availability and accommodation, affordability, as well as appropriateness, while the patient level factors includes ability to perceive, ability to seek, ability to reach, ability to pay, and ability to engage. So in general, there are three types of barriers to access healthcare. So personal barriers, financial barriers, and organizational barriers. Personal barriers include recognize the need, decision to seek services, and accept the services to use. The financial barriers includes out-of-pocket cost for some services, time lost for work or in traveling to and from a clinic, while the organizational barriers includes availability of adequate health services, long waiting list, waiting time, as well as distance to the health center. The equity in access entails that the resources are mobilized to meet the needs of different groups in the population. Equity introduces the notion of fairness and social justice. There is an inadequate healthcare utilization among the culturally and linguistically diverse population, which is largely due to lack of English language proficiency, lack of understanding of healthcare pathways, poor health literacy, high out-of-pocket cost, cultural incompetent health service delivery, and underrepresentation of CAL population in the healthcare workforce in Australia. So that ends the module 4. Thank you very much for listening.